My name is Daniel Lombard. I'm a research officer at PSSRU. I joined the unit about a year ago, well, full-time about a year ago. Before that I was doing freelance work on a sort of ad hoc basis for the unit. That was mainly in communications, but since completing a master's a year ago in social research methods, I joined the unit full-time, so I've been doing various projects with them since then. Group bonding with each other and doing a treasure hunt as part of an away day around the streets of Westminster. Yeah, at the moment I'm working on a project on direct payments in residential care, which is funded by the Department of Health. So that's very focused on data collection at the moment, which looks at the running of this policy, direct payments, within individual councils. So we're getting lots of data from councils and going through that data at the moment. So I'm responsible for being the main contact for various council officers as part of that research project. I'm also involved in the MODEM dementia project, which is a large-scale project looking at the future projections of dementia and the costs involved with the illness over the next 25 years, and the possible outcomes of different ways of approaching the illness, different interventions designed to address problems related to that particular illness. So mostly I've been involved with literature reviews, and I'm getting in terms of the type of work that I do, I'm getting more involved with the day-to-day running of projects now as well. A good contribution to the Schizophrenia Commission, I think, which was a major investigation into the interventions to address, to treat schizophrenia. That was run by Rethink, which is a mental health charity, and PSSRU was one of the partners involved. So my role was to do a literature review, which informed the work of the colleagues working on the commission as a whole, and I found that was a really worthwhile project, which helped to improve the evidence base, and hopefully in the future will go on to improve the quality of life for people with schizophrenia. I think it's done some really good work on social care outcome measurements, so that people in residential care, for example, have the opportunity to have their views on their quality of life measured in a way that can be transferred to different types of research and can be analysed in a useful way. So that that side of the unit's work has been really influential, I think. So yeah, that gives the user more of an opportunity to have their voice heard through those research tools. So that's opened up more opportunities for high quality research projects based on surveys and questionnaires for people in receiving social care, particularly in residential care, but also other settings as well. Some areas of social work have been somewhat stuck in the past, particularly compared to medicine, for example. If you look at the medical profession, 99% of the interventions that doctors would recommend are totally based on evidence of good practice, from bodies like NICE and so on. There's been much less systematic focus on evidence-based practice in social care, social work. Areas like child protection, I think there's been a real difference of different approaches and really variable quality in social work departments in local authorities, for example, and that's been quite led to very negative outcomes for children and families in some cases, particularly some of the more controversial cases that have been in the news over the last few years. So I think social care is lagging behind in that respect, but there are some really positive developments. So bodies like Skills for Care have been working with universities and bodies like PSSRU to help disseminate evidence of good practice among the profession, and that's been really positive. So there have been lots of innovative areas of innovation as well in local authorities like Hackney. For example, their children's social work teams are now based on a model of multidisciplinary working with lots of different professions working together to support problematic families. So, and that's been fully evidence-based. I think Professor Eileen Munro from the Department of Social Policy at LSE has actually been working on evaluations, although that's outside PSSRU, but she's been working on an evaluation of that model, and I think that's been really successful. Yeah, I would like to see much more integration between health and social care and some kind of policy to break down the barriers between the funding models. So people with dementia, for example, have to pay for their own care in most cases, because it's seen as a social care issue rather than a healthcare issue, whereas people with diabetes or cancer, they would get their care and support packages funded on the NHS. So I think there's a real inequality there. So I would like to see much more pooling of budgets across health and social care, so that you're not going to face not only the misfortune of having dementia, but also having to break the bank to be able to have a good, decent quality of life to get your own care. Issue with the demographic changes that are taking place and projections for the ageing population to massively increase the older age groups. So there's a much greater likelihood of people contracting dementia and other illnesses related to old age. So that's a huge challenge that's facing the social care sector and the healthcare sector. And people are quite rightly having higher expectations of the kind of care and support they're going to receive. So it would those two issues mean that the social care sector is likely to have to expand or to change the way it's working so that people really get the support that meets their needs. And people, so for example, people might expect to live in their own homes, which means rather than residential care, I know that people with learning disabilities now are much more likely to be able to live at home rather than long-term institutions, which was the case in the past. So that creates challenges for how people are going to be supported at home, and perhaps there's more expectation on a heavier burden on family members to look after the loved ones who are staying at home, and that creates a challenge for how do we look after those carers who are shouldering such a huge burden in terms of the care and support sector. I think their voices are often ignored or left out of the debate, so that's another really important issue as well. Well, I'm hoping I've got a few years to go before I will need that myself, so at least there's a bit of time for some development to take place. So in terms of what I think, I think there are areas of good practice at the moment. I think the funding crisis is a really important issue, but within the next 20 or 30 years, I imagine that would the fairness of the funding system that issue would have been dealt with, and the lack of equality of people having to pay for their own care compared to people who get their healthcare paid for in the NHS. If that can be addressed, then I would be more confident that it would be a more fully funded and equitable system. So at the moment, there are major issues and major problems with the system, but changes and reforms are underway. So we'll have to see how that pans out.